Good afternoon. My name is Chrissy Matheson, and I'll be your moderator for today's press briefing. Before we begin, I'd like to introduce the Premier of Nova Scotia, Stephen McNeil, and Nova Scotia's Chief Medical Officer of Health, Dr. Robert Strang.
Thank you, Chrissy, and good afternoon, everyone. I'm happy to report that there are no new cases of COVID today. Dr. Strang will have more details on the current cases in a moment. But first, I'd like to talk to you about our border. The Canada-U.S. border is closed to all non-essential travel. But if you are a Canadian citizen living in the U.S. and you want to come home, you have the right to enter your home country and you will not be turned away. Dr. Strang has a call this afternoon with Canada Border Service Agency to better understand federal protocols around entering and isolation at the Canada-U.S. border. There are many Canadians living in the U.S. who want to come home. Among them are Nova Scotians. If you are a Nova Scotian crossing the Canada-U.S. border, and you will have to show your Canadian passport. When you get to the Nova Scotia border, you will be asked to provide ID, an address of where you are staying, and a phone number. This applies to anyone coming from anywhere outside of the Atlantic bubble. So if you are coming from Ontario, for example, you'll be reminded that you must isolate for 14 days and to follow all public health protocols. If you tell the border security you are coming for less than 14 days, you will be turned away. There are lots of stories circulating, conversations on social media about Americans and others who are coming into our province and not self-isolating. If this is true, it's not acceptable. If you commit to self-isolating for 14 days, we expect you to keep your word. So we will be ramping up our calls and check-ins to make sure you are where you said you would be and that you are indeed self-isolating. We want to be open and welcoming, but we are not going to let our guard down. Dr. Strang.
Thank you, Premier. Good afternoon, everybody. As the Premier said, we have no new cases to report today. So as of today, we have 1,064 confirmed cases of COVID-19, 3 of them which are active. We've had a total of 54,317 individuals tested for COVID-19 with negative results, and we have 63 Nova Scotians who unfortunately have died from COVID-19. As many of you are probably aware, we've had 3 new cases of COVID-19 identified this week. I know that each case does bring concern, and particularly after having gone 20 days without any cases. As we've been doing all along, in each of the cases this week, we released the information that we can, respecting the need for privacy and the legal requirement around that. Like always, my public health colleagues at the Nova Scotia Health Authority conducted immediate contact tracing in each of the positive cases, and we have tested all their close contacts. Like we did this week, as you may have seen, if we need to do a public notification, because we're not sure we can contact all contacts directly, we have done that, and there was a notification around the first case about who was just the beginning of his infectious period when he flew from Toronto into Halifax, and when there was a public notification on that. We know that in all 3 cases, the people were recently outside of Canada, and we are comfortable concluding that that is where they would have come in contact with COVID-19. So the source of their infection was outside of Canada. We know in each case that the people did what they were supposed to do under the Health Protection Act in terms of any requirements for isolation. So that's comforting to know that people are understanding and the protocols we have in place around temporary farm workers are working. Again, in each of the cases, when people became symptomatic, they came forward and got tested, and because they'd had appropriate isolation, we have had very few contacts, a half a dozen contacts in total from all 3 cases. So overall, this is a very good news, which what we really expected, that the likely source of new cases in Nova Scotia would be from people exposed outside, especially outside of Canada, and that the things we have in place to rapidly detect people and the requirements around isolation minimize contacts here within the province. But it's an important reminder about the rules are there for a purpose. The rules around 14-day isolation periods and what we ask people to do to come forward and get tested as soon as they become sick. There's a reason behind those, and it's important that those are followed. As we said, we've tested contacts that we may get some further cases from the small number of contacts that we have tested. That will tell over the next week to 2 weeks. But if people hadn't been isolating as they were expected, we could have had a much more serious situation. I can't emphasize enough the importance of the rules and the recommendations from public health are there for a purpose, and it's important that we all follow them. And which leads me to some observations I made, that in the last week, since I was on self-isolation for 2 weeks, since that's ended, I've been able to be out and about a bit more. I've even gone into a couple of stores. But what I'm seeing, and certainly what I'm hearing from other people, is that I'm extremely worried that people are becoming complacent. That I'm seeing a lot of situations where people are not maintaining the 6 feet or 2 meter physical distance where that's possible. Lots of circumstances where our recommendation around masks is if you're in an environment around other people and physical distancing can't be maintained, so that's basically any indoor retail environment, malls, etc. The vast majority of people are not wearing masks. These are critical pieces, that keeping apart the physical distance as much as possible, and where that's not possible, wearing a mask. They're extremely important in terms of all of us practicing those. It's those measures along with the other personal preventive measures that I talked about last week. So staying home if you're not feeling well, making sure you have good frequent washing of your hands, what we call cough hygiene. If you're coughing or sneezing into your sleeve. Being cautious about where your hands go and not touching your face, frequent cleaning of surfaces. It's all those things that we need to do together, along with the distancing and the masking, and then creating, whether it's retail environments, workplace environments, or community environments that support all those. Those are the tools we have to minimize the impact of COVID-19. We will get more cases. How we control the spread and what will allow us to remain open as much as possible is all Nova Scotians practicing that package of personal preventive measures. We have certainly strengthened our recommendation around masking, but we have a lot of work to do to change the norm around masking. So I'm really asking Nova Scotians to think about what they need to do to improve their practices around physical distancing. We're allowing some social contact, but being very thoughtful about how you limit that, and using masks where you can't physically distance, and all the other measures that I just described. We got to where we're at because we were very diligent about, and we had very tight restrictions. As we necessarily loosen those restrictions, we have increased risk. What will allow us to remain open as much as possible is all of us taking the preventive steps seriously. So we can't afford to have complacency about that, because we know that COVID-19 is not over. It is part of our new normal, and so we all have to be better at doing what we can to prevent its spread, to protect each other. I know that I've heard a lot, as the Premier said, a lot of concerns about people coming in now to Nova Scotia from outside Atlantic Canada. And as the Premier said, we are actively working to increase the collection of information and monitoring individuals as they come into our province and making sure they're adhering to the isolation period. Lots of people are saying, well, we should not let people come. But that's really not practical or feasible. Opening up our province to visitors and Nova Scotians coming back is essential to many businesses, to our overall economy. It's also important for vital reasons for family and social connections. So we cannot remain locked down forever. We do have to open up and allow more travel, but at the same time we need to do that safely. And that's why we need to maintain the ability to test and have rapid public health follow-up, but it's equally important, as I described, all the personal preventive measures that we all need to do, that we need to really step up our game and be very thoughtful and careful about those, because it's those together. If we all do those, that allows us to remain open and allow us to have an open summer and enjoy a number of things. But if we're not careful, we run the very real risk of having a resurgence of COVID-19 and having to tighten things up again, which I know nobody wants to have. So I'd really ask people to maybe think about not worrying so much about each other, what others are doing, and focusing on what we're doing. What are each of us as individuals doing to prevent the spread of COVID-19? And just on testing, we know that the QE2 lab still remains 24/7 capacity, that there were 372 tests done yesterday. We're still making sure that Nova Scotians who require testing have easy and rapid access to testing. I continue to remind people that if they have any of the symptoms that are on our COVID-19 website, any of the symptoms that could be associated with COVID-19, to reach out, do the online 811 assessment, and if you can't do that, to call 811, and you take their advice from there moving forward around whether you need testing or not. Today is the day where the new gathering limits, which we announced last week, come into effect. So I'm just going to remind people of what those gathering limits are. And it's an important reminder that as we open up all these opportunities for larger numbers of people to get together, these are places, these larger gatherings, where it's really important that the people around the rules, especially, if you can be social distance, you need to continue to be distanced. If you can't be sure of that, then it's really important that everybody wears a mask as part of allowing these gatherings to happen in a safe manner. So starting today, recognized businesses or organizations can hold outdoor events with up to 250 people. And indoor events can happen with 50% of the capacity of that indoor facility, up to a maximum of 200 people. The type of events that can be hosted are arts and culture events, special events and festivals, faith-based gatherings, and weddings and funerals. It's important to understand that these expanded gathering limits are only for events, these type of events, when they're run by a recognized business or organization. So, an examples of what could be a recognized business or organization are, if they're wedding or event planners, hotels and convention spaces, churches, synagogues, mosques, and various types of theaters. We have put this in place because we need to have a recognized business or organization who can take on the responsibility that on hosting an event that can follow the public health measures that will allow a gathering to happen safely. If you're thinking about having the gathering and it's not run by what we call a recognized business or organization, then that gathering limit must remain at 50. So, for example, if you're holding a family reunion or a backyard wedding, then the limit for that is it needs to be held at 50. That simply because if without a recognized business or organization that can be held accountable and has the resources to implement the proper safety measures, we need to restrict the number of people that can gather. Large gatherings of people are significantly increased risk for COVID-19, so it's important that they can be done in a safe manner. And in all of those scenarios, any type of gathering, whether it's up to 50 or the new limits, that its physical distancing must be maintained, except if people are from the same household or if they're in a pre-selected group, close social group of up to 10. Today is also a big day in terms of the Atlantic bubble. Came into effect this morning, and I know that our borders are very busy, along with the borders into our neighboring provinces as well. That it really allows us to open up, and now we're all Atlantic Canada. We are kind of all in this big bubble together. I know that a lot of businesses, especially related to tourism and public service, have very much been looking forward to today, and we'd like to welcome anybody from any of our Atlantic neighbors who are now making the trip into Nova Scotia. We ask that they familiarize themselves with Nova Scotia rules under the Public Health Act and the state of emergency, and follow those. It's important that they follow the rules while they're here, like all Nova Scotians. As we announced yesterday, any Atlantic Canadian resident who plans to visit Nova Scotia will be required to show proof of a permanent residency in their Atlantic province to be able to enter. There's a range of types of identification that are acceptable. Those are all on our website. We encourage Nova Scotians who are traveling to other Atlantic provinces to go to those provinces' website and familiarize themselves with the rules of the province that they're entering and the requirements for entry into those provinces. We've tried to make the identification that's necessary as consistent as possible to make it as easy as possible to move between provinces. But each province does have some different rules and some differences in the process for entry. And to make it easy, on our provincial website, so that's novascotia.ca/coronavirus, we've added links to the same type of websites in each of the other Atlantic provinces as well. So it's important to go online, whether you're going to travel, you're thinking of leaving Nova Scotia and then coming back for some type of vacation or trip. It's important that you familiarize yourself about what will be required when you come back to Nova Scotia and what will be required when you go to another Atlantic province. That it's important to understand that while we've made this change and created an Atlantic bubble, as the Premier said earlier and I said too, there are no changes to travel from outside Atlantic Canada. We still have the requirements that anybody coming in from another Canadian province west of Quebec and west, or from any other country across our international borders, is required to isolate for 14 days, and that includes Nova Scotians. If you choose to take a vacation in Ontario this summer, you will be required, at this point in time, you would be required to come back and isolate for 14 days when you come back into Nova Scotia. Those are important because we still have varying epidemiology in different provinces in the country, and certainly anybody who's looked at all at the news, our neighbor to the south is in a very different situation related to COVID-19, and there's lots of COVID-19 activity in other countries as well. So it's important that we continue to respect the need to protect Nova Scotia by having strong isolation of people coming into our province where appropriate. I want to move on very quickly to a slightly different topic, but it is an impact of COVID-19. Earlier today, the Nova Scotia Health Authority announced that they will be restarting the grade 7 immunization clinics. So typically we have all our grade 7 students in our public schools are offered a range of vaccines on different occasions throughout the grade 7 school year. Those clinics weren't able to be the third dose of vaccines weren't able to be offered this spring. So public health, in anticipation of needing to do the new grade 7 class in the fall and maybe having to do something somewhat different for them, we need to make sure that the students who have just graduated from grade 7 get their vaccinations throughout the summer. So public health will be holding clinics in July and August for the recently graduated grade 7 students. There'll be a lot more information coming to those families and to those students. We're working with community partners. We're working with our partners in the regional centers for education on this. The clinics will be held and run in a way that keeps social distancing, so they are designed with COVID-19 safety as top of mind. More information on that will be coming out, but I wanted to make sure people were aware of that coming. And if you've had as a family, if you've had a student recently graduated from grade 7, pay attention. There's more information coming, and I highly recommend, or more than highly, I can't say how important it is that any students who didn't get that third dose of vaccine against the diseases we immunize against are all important. Hepatitis B, human papillomavirus, HPV, meningococcal disease, tetanus, diphtheria, pertussis. Those are all very important to continue to be protected. So this is a critically important thing to put into your schedule as you get more information. Make sure that the students finish off the vaccine series. In conclusion, I know that as we went through the last 20 days with no cases, that people were feeling a sense of relief, and perhaps that's contributed a feeling that things are over and we can let our guard down. But that couldn't be further from the truth. We have to continue to pay attention to COVID, continue to be wary about it, and take the necessary prevention steps. And maybe the cases of this week are actually, in some ways, a fortunate reminder about our needing to maintain our vigilance, that COVID-19 is part of our new normal, and that as we continue to open things up, necessarily so, we do have risk of COVID-19. And as I said, that the way we control this, it's in our hands to a large extent. We need to all take ownership of the things that we can do, the steps I've outlined last week and outlined again today, that what are each of us going to do to make sure that we're keeping each other safe by following all the preventive steps around COVID-19. Premier.
Thank you, Dr. Strang. Let's see if that answer any questions.
Reminder, one question and one follow-up for the reporters on the line in the amount of time that we have for today. First question will go to CTV's Natasha Pace.
Hello. Premier, you mentioned that there's been a lot of reports of people concerned about some license plates from the United States. Can you go into some more detail about just, I guess, how many concerns you've heard or how many complaints you've heard, and whether or not you'll be increasing staff to keep up with this?
So, we've heard, like many of you, through social media and other contacts, people from across the province talking about American plates being in our province. Again, I will say this. The American border is closed. If you are a Canadian citizen living in the U.S., you have a right to enter into your country. When you come to the American border, you would show them your Nova Scotia passport, your Canadian passport, and you'd be allowed into Canada. And some of those are Nova Scotians who are coming home to property that they would have here, or coming back to their province. When they get to our border, we would ask where are they going, look at the address, looking for a phone number, and advising them that we fully expect them to isolate for the 14 days while they're in this province. If there are, and we will do follow-up on that, but if there are communities across the province that feel that American tourists or American Nova Scotians who are coming home are not following that self-isolation, they are to contact their local detachment of the RCMP, who will then do another follow-up to ensure that people are following the public health protocols of our province. I would also tell you, and just to remind everyone, that the Atlantic bubble is open today. That does not apply to those who live in Ontario, Quebec, or Western Canada. If you're coming into our province, you're required to self-isolate as well.
Natasha, go ahead with your follow-up.
Thank you very much. Dr. Strang, you mentioned that you've been out and about and seeing a lot of folks not wearing masks, and I'm just wondering whether or not, I guess at this point it is still optional whether or not you choose to wear a mask. Is there any thought to making it mandatory to wearing masks in indoor spaces where you aren't able to physically distance?
Yeah, I mean, so mandatory is certainly not off the table. I mean, there's a general principle in public health that we always start with less or more kind of persuasive methods. Something like making something mandatory or banning something is always kind of our last step. I think there's a lot of things that we can do collectively before to increase mask use. Frankly, it's about changing our social norm about mask use. So we're working on now about how we start to reach out to in a more robust way to communicate to Nova Scotians. How do we communicate with all our different business partners, retail sectors, restaurants, et cetera, and in communicating to them and engaging them in a way that they have a stronger message in their environment about the importance of wearing masks, both for staff and for customers. We're also looking at how we perhaps maybe support those places with masks and allow to make sure they have masks available to give to people if people don't have their own masks. So we're looking at starting to look at a number of those different pieces that once we've given those a chance, and we'll see what we can do to increase mask use those ways. But certainly mandatory is not something that we were taking off the table. I don't feel it's necessary or even appropriate to go right to a mandatory policy right away. We also have to think about that watching our epidemiology, that certainly if we saw an increase, started to see a substantive increase in COVID-19, I'd be certainly thinking much more strongly and talking to the Premier about maybe it's the time to be going to mandatory. But I think there's a number of things we can do that are less intrusive, and it's always a balance about individual rights, and there's legal issues versus mandatory. There's a number of things we can do without having to get into those kind of discussions that I think can have an impact and increase the number of Nova Scotians wearing masks.
Next question will go to Mike Gorman with CBC.
Thank you. Dr. Strang, I'm wondering, we know the size of your office and the capacity that you have, and now that we've got this steady flow of folks coming into the province that we haven't had for the last few months, how confident are you that your office has the capacity to follow up with potential spikes that we may see as a result of all of these new people coming into Nova Scotia?
Well, it's not just my office is small, and then we have numbers of people, and it was the Nova Scotia Health Authority, their public health staff. We certainly know that we were substantively challenged by the volume of cases during Wave 1. We're working on bringing forward some of those capacity issues. It's certainly one of the things we put on the table in getting support. The federal government has a number of different streams for all provinces and territories around some funding opportunities to help us to be better prepared for Wave 2 and to support reopening safely. So we put forward a number of requests around public health capacity through that federal opportunity as well. But we certainly know that that our public health capacity is one of the issues that we need to pay attention to. It's capacity in public health and the health system, which are one of the things that we monitor, that are important things that we have to think about as to that factor into decision making around what we need to put in place to control the spread of COVID-19.
Mike, go ahead with your follow-up.
Thank you, Premier. I'm wondering, just to follow up on what Dr. Strang has said, what steps you and your government are taking to try to address and enhance those capacity concerns? And also, I'm wondering, one thing that's just been brought to my attention, I'm wondering if either of you can talk about the discrepancies between provinces in terms of what people need to present and prove before they can come in. It seems that it's more stringent to get into New Brunswick and PEI than it is here. And I'm just wondering if either of you have any concerns about inconsistencies on that front.
So to your first question, we continue to work with Dr. Strang's office about what they may require in terms of whether there's a dealing with current COVID or how do we follow up. As you know, we put in place some support around 811, doubled the capacity, and then increased it again when it came to answering questions from Nova Scotians who felt they might have been exposed to COVID. We expanded our testing model going through. We increased through the hard work of the lab with Dr. Strang's office. Our testing went from 200 on the first day, first week or so to, at one point, we were pushing the capacity of 1,500 to 2,000. We were even doing some tests for our neighboring provinces at that time. We have been, and I am cognizant of the fact that this has been 3 or 4 months of really 7 days a week for public health, and particularly those in the lab who are doing the testing with us. So we'll continue to work with Dr. Strang and public health, as well as he alluded to in his answer, the health authorities and their people in public health. And the national government has also stepped up with some support. We'll see whether that dovetails into our ability to be able to either expand what we currently do, but we are monitoring that, and we'll obviously work with the experts in his department. In terms of coming into our province and within the region, as I said, we're opening up Atlantic bubble. It's my view, people from within the region should be able to move freely across our borders and around the province. Obviously, there's been a lineup at the Nova Scotia-New Brunswick border going in both directions. We'll work on that over the next couple of days. Is there ways that we can smooth that out for Atlantic Canadians? And then those who are coming in beyond, we will continue to ask for, giving them the information, self-isolation, where you going, and looking for phone numbers, and particularly those who are coming from the U.S., and we will do that follow-up. And we will increase that protocol really to respond to the concerns we're hearing out in the community, to verify that they're real, quite frankly, and we'll engage the RCMP in many of our rural communities to do that second wave of follow-up if we continue to hear complaints about people not self-isolating.
Next question will go to Jeremy Keefe with Global.
Thanks. I'm just wondering, because we talked a little bit about some of the rules varying around the Atlantic. If you could kind of, maybe this would be better for Dr. Strang, if you could give it an idea of what travelers coming into Nova Scotia, particularly from New Brunswick, PEI, and Newfoundland, what they might need to keep in mind regarding our rules here in Nova Scotia that might differ a little bit from what they're used to.
So I think first of all, coming in, we all have similar requirements around proving that you're a resident of New Brunswick or PEI, and that's based on whether it's a driver's license, a passport, or some other official mail like a bank bill or a power bill, something that shows every adult in the car that they are actually a resident. Once they get into here, clearly they no longer have to do the 14-day isolation period. Each of the provinces, we do have limitations in terms of how people gather and exact numbers of how they can get together. We've tried to keep that consistent, but haven't been completely successful. I mean, those are the most important things: is that how we allow people to gather and the numbers that can gather. Especially the numbers may vary, but certainly the principles are the same in every province: maintaining physical distance as much as possible, limiting your close social contacts, paying attention to, really good hand washing, what I call cough etiquette, not touching your face, cleaning common surfaces down. Those are the public health principles that apply regardless of wherever you go. So I think without getting people too worried about the nuances of different rules, if everybody can think about those steps that keep them separate from others as much as they can, wearing a mask when they can't be assured of being kept separate, good hand washing, personal hygiene. If everybody focused on those, then I think we'd be in a good place to have people's attention in the right areas, and some of the nuances around rules that don't make as much of a difference.
Jeremy, go ahead with your follow-up.
Okay, I know that there's some people who think that opening up the Atlantic bubble today might be a bad idea, considering the success we've seen over the last couple of months in keeping our COVID numbers down. I'm wondering what you have to say to those people, and what procedure will be followed in order for that to change. Like, what would happen that we would then take that Atlantic bubble and once again close our borders?
So from a public I've had a number of conversations in the last few weeks with my chief medical officer of health colleagues in the other Atlantic provinces, and we were clear. Our focus was on what is the epidemiology telling us, and we have reached a point where in all 4 provinces it's very low and stable. And so really there's no increased risk for if I travel today from here to Sydney, there's no or I chose to go up to the Miramichi, I am not putting myself at any greater risk on either of those trips. So we're at a point with our collective epidemiology where there is no difference in risks as we travel between Atlantic provinces, and therefore we are at a point where we agreed, and our common recommendation to our premiers was that it was now, from a public health perspective, safe to remove travel restrictions and allow movement between our provinces, because there is no difference in risk when we travel, or the risk of being exposed is equally low and stable no matter where we travel in Atlantic Canada. If that changes, and we will continue to keep our eye on our collective epidemiology, I'm continuing having weekly phone calls with my Atlantic Chief MWH colleagues. We share, looking at each our epidemiology, and if our conclusion changes that we now have a difference in risk of exposure by being traveling between one Atlantic province or another, we will bring forward perhaps a different recommendation for our premiers to consider.
Next question will go to Andrew Rankin with the Chronicle Herald.
Oh yeah, this is for the Premier. The ban on residential evictions for people financially impacted by COVID ended Wednesday, and there are reports that Access Nova Scotia is processing well over 1,000 eviction applications. So what steps is your government taking to manage the public health impacts of potential mass evictions in this province?
Question yesterday, I believe, Andrew. I said to you when I introduced the moratorium, it was for 3 months. That would have been lifted at the end of June. What we have seen going through we would open up both our court system and Service Nova Scotia, which happened yesterday. The Residential Tenancy Board probably will not have any sittings until sometime in August, is my understanding. It's also my understanding that many of the tenants who were impacted by COVID have worked with their landlord to find an appropriate way for them to be able to pay that rent over a period of time if it has been impacted by COVID. I do also want to tell you and remind you that evictions related during this period of time or before that had been put on hold in some cases had nothing to do with COVID, had to do with other issues between a tenant and their landlord, and that's what the Residential Tenancy Board is there for, is to mediate between the tenant and the landlord and then make a ruling.
Andrew, go ahead with your follow-up.
Okay, yeah, this government is encouraging Nova Scotians to get on with their personal and business affairs, and that this can be done in a safe manner. However, last week you indicated it would be unsafe for you to resume in-person briefings with the press. Important all-party legislative committees have not met for more than 3 weeks or 3 months. My question is, when are you and this government prepared to resume its important business of in-person briefings with the press and resume legislative committees, both of which are critical mechanisms for proper government oversight?
I've been actually doing government business now for months through the process of dealing with COVID. I continue to work with my colleagues, communicate directly to Nova Scotians and to those of you in the press. I have said legislative committees will not be brought back until into the fall, which is the normal practice in our province, that legislative committees stop sitting normally in June anyway. You alluded to public accounts and the health committee. I don't think is the proper use of Dr. Strang's time or anyone in my Department of Health's time is to sit at a committee and prepare for committee meetings when I need them focused on dealing with COVID and how do we open up our economy with COVID. That's what we will continue to focus on. And when the appropriate time is and that we can arrange the appropriate space for in-person interviews with media, we will do so. They'll look very differently than what before. The scrums that have been used to will not be there for me. I can tell you my personal health is more important to me than to be stuck in the middle of a scrum. I'm looking forward to a chance to be in the same room with you, but that'll take place at some time in the future date when we know we can do it safely.
Next question will go to Olivier Lefebvre with Radio Canada.
Merci. My question is for the Premier. Would you need the agreement of all the Atlantic provinces to open Nova Scotia to the rest of Canada without the requirement to self-isolate? And are you still looking at mid-July to do this?
We're going to follow what happens over the next number of weeks with the advice of public health. I certainly have been talking with my colleagues in Atlantic Canada about being able to do that together. I think that would be ultimately be our goal. But obviously, any province in the region could do it separately if they wanted to. But we will continue to work together collaboratively in the region. And I think all of us have said, we're looking to towards the end of the second week, third week of July to try to open up to the rest of Canada if that's possible. And the epidemiology points in that direction. I think all of us have said we're encouraged by what's happening in central Canada now in terms of the numbers, and our public health people will certainly be a big part of that conversation.
Olivier, go ahead with your follow-up.
Thank you. This morning there have been reports of long waits at the provincial borders. Do you expect this influx of people to be temporary, or if not, do you have plans to send more people at the border to reduce the lines? Because, for example, workers that have to go to New Brunswick for work this morning have to wait more than an hour only to get to their dedicated line at the border.
Yeah, so obviously, we were having, my understanding on our side, we were having about 3,000 vehicles a day crossing that border. We've already surpassed that today. So we'll work, and there's ongoing calls with our people on the ground through the Department of Environment, who's been monitoring that. And we'll make adjustments accordingly. You highlighted an important part is those essential workers are going back and forth. How do we have smooth passage for them? Same time, how do we ensure that Atlantic Canadians are able to move around across our borders? But we also want to make sure that we're capturing anyone who's from outside of that Atlantic bubble so that we can communicate to them directly. And we'll try to do that more efficiently and learn from this morning and today as we move forward into the next week ahead of us.
Next question will go to Lindsay Armstrong with All Nova Scotia.
Hi, thank you. Dr. Strang, looking to September school year, which is just over 2 months away, yesterday Minister Churchill mentioned potentially opening schools at half capacity. From a public health perspective, what would the COVID caseload have to be like to go ahead with 50% in school capacity or 100% school capacity?
I mean, there's no set number of cases or the of that we would say that drives that we as a specific target. We know we need to continue to look at the epidemiology. I continue to have conversations with the Department of Education around, and I know they're working on 3 different scenarios, which is full capacity, half capacity, and then everybody at virtual learning. And what we've agreed is if they develop kind of plans in each of those 3 scenarios, once we get closer to September, we'll be able to know exactly where we're at with the epidemiology, and we can adjust within those 3 different scenarios of what actually makes sense. We have to understand that while we need to respect COVID-19, there's also a huge importance from a education as well as a social development perspective of having kids in classrooms as well. So we need to balance, like everything else with COVID, we need to balance COVID safety with the impacts of having restrictions. So there's no final decisions to be made at this point, but I continue to work with education on all those pieces. So my training is broadly in public health. It's not just about COVID, and so I'm bringing that broader perspective that while respecting COVID safety, we have to look at the other important child and youth health perspectives as well that need to be taken into account as we make decisions about the education system.
Lindsay, go ahead with your follow-up.
Thank you. Dr. Strang again. From a health perspective, can you lay out the risks of an in-person scrum as the Premier described, given the use of things like masks and microphone holders? What is the risk level of a scrum compared to just people working in an office space?
So I mean, certainly know with COVID, the more people are together, the closer they are, and the longer that contact is, and that you're increasing the chance for a virus to be spread. I've been in scrums myself. I've seen lots of scrums. They're quite noisy and loud, and that loud voices can support the more spread of virus. So I think, like anything, my advice would be that is there a way to conduct a scrum that actually maintains a minimum of 6 foot distance that keeps people apart. Surely there must be ways that we can have dialogue between elected officials and the media that respects the requirements around social distancing, et cetera, that don't require large numbers of reporters and one or more elected official, in very close contact with each other.
Next question will go to Evan Taylor with CKBW.
Hi, my first question is for the Premier. With the situation at the border, I was wondering if you could just explain what the protocol is for essential travel, and should they be subject to these lines, or do they have solutions to get around them to ensure that they can transport their goods in a timely fashion?
There is a separate lane for trucks that were moving goods and services in and out of our province. Though there are many essential service workers that are going across the province, whether it's related to healthcare, or some of the manufacturing sector in the Amherst area has people working in from New Brunswick. They have identification which would be with their vehicle, so they wouldn't have to show ID each and every time they come through. Obviously, with the volume of traffic that we've had today and cars coming to the border, we will analyze what that looks like, and is there a way, particularly for the essential service people, to be able to get across the border, in a timely manner, just like our trucks are. And then look at what do we do about how can we best identify the Atlantic Canadians quickly to be able to move them across the border, and then be in a position where we're actually just getting the details from those who are from outside the Atlantic bubble so we can track them and know where they're at.
Evan, do you have a follow-up?
I do. As well, I was wondering if any extra resources have been allocated to monitor Nova Scotia's waters to ensure that vessels that might be coming from out of province or out of country, which I believe they should not be able to do under the current protocols. Are there any resources that have been allocated to enhance monitoring of that? And also, if somebody does believe they see a vessel from somewhere it's not supposed to be, do they report it to the same channels you mentioned earlier?
So a couple of things on that. And so any vessel that coming from outside of Canada, that's under federal jurisdiction, and we have lots of protocols in place, long-standing around between Canada Border Services agencies, port authorities, etc. Knowing that we understand certainly on the cruise ship side, any vessels of 100 people or over are not going to be allowed, and so we're focused on those smaller vessels, most of which are day trip vessels for tourist purposes, as well as our local ferries. On the commercial side, I've been involved in some conversations around, very recently around, for instance, cargo ships coming from Ontario or Quebec through the St. Lawrence Seaway, then coming here. And there are protocols in place for the crews on those ships, making sure that they are adhering to the requirements around isolation period for the times that they are here in ports in Nova Scotia.
Next question will go to Tim Biscay with the Halifax Examiner. On the line? Tim, was that you? Moving on to Kyle Shaw with the Coast.
Hi, for the Premier. I hear Dr. Strang saying today we do want and need to open the province eventually, but at the same time we need to keep up the strong 2-week isolation protocols for people coming from places where COVID is very active still. So in the last 14 days, there have been 4 cases of COVID announced in Atlantic Canada. And at the same time, the rest of Canada has had more than 4,500 cases. So are you still aiming to drop the quarantine requirement for visitors from the rest of Canada by the middle of July? Or are we going to wait until the epidemiology shows that the virus has slowed down in the rest of the country to the sort of pace we're comfortable with here in the Atlantic bubble?
Said from the very beginning now that it's our goal to open up our province to the rest of Canada the second, third week of July. I think that's the common feeling amongst Atlantic Canadian premiers. But obviously we'll be guided by the epidemiology across the country. And as I said earlier, we're seeing positive signs in central Canada. The numbers are going in the right direction. But we'll follow what happens with opening up our Atlantic bubble and then reassess on what we do when it comes to the rest of Canada at that appropriate time.
I'll go ahead with your follow-up.
Okay, this is for Dr. Strang. You talked about preferring persuasive methods versus making things mandatory on public health measures. I was struck by the new Hockey Nova Scotia guidelines that came out this week that said, quote, physical distancing is not required in groups of 10, unquote. So this doesn't sound like the way you described the persuasive intent around your carefully pre-selected groups of 10. Did you sign off on these hockey guidelines, and do you think they are accurately reflecting your intent?
So I haven't signed off on individual sport guidelines, but continue to work with colleagues in community cultures and heritage who have the connect into Sport Nova Scotia and continue to work with Sport Nova Scotia. What we've said in sport, like other group activities, like whether it's summer camps or daycares, that you can have groups of up to 10 that don't need to adhere to that requirement of maintaining a minimum of 6 feet distance between people at all times. So within a sport environment, you can have a total of 50 kids and coaches we're talking about hockey on an ice surface. Within that within that you can have groups of up to 10, and within that group of 10 you don't have to have maintaining physical distance, and that's no different from hockey versus soccer. It's the same general principles that apply to all those, and it's the same way we're running summer camps, etc. What we have said is even within those groups of 10, you don't have to keep the 6 foot distance, but you should actually try to keep the kids separated as much as possible, even within that 6 feet. So if they're 4 feet apart, it's better than 2 feet apart, and minimizing any really close contact. So even within a number of the team sports, whether they're hockey, whether it's rugby or football, basketball, they can do things within that 50-10, but what they're not allowed to do yet is do kind of competition or drills that would inherently, because of the nature of the sport, have ongoing, repeated, very close contact between individuals.
And that's all the time that we have for questions today.
Thank you, Chrissy. Off the top, I talked to you about the Canada-U.S. border and those traveling from outside of Atlantic Canada or our Atlantic bubble. Now I want to talk to you about our Atlantic neighbors coming into our province. They do not have to self-isolate because our numbers in the 4 Atlantic provinces continue to remain low. Today our border was backed up for several kilometers. People who are coming and going through the Maritimes, anxious to see loved ones, keen to play tourists, and we need our Atlantic neighbors to rediscover Nova Scotia. We want them to come here, to eat in our restaurants, to shop in our stores, to take a tour of one of our tourism icons. Opening up the Atlantic region is good for our economy, and it will help us gain confidence as we learn to live with COVID. Your health, though, is our top priority, but we need to open up. We are doing it slowly and safely, but if at any point we see a spike, we will reevaluate at that time. So this weekend, when you see visitors from Atlantic Canada, don't forget they're nervous too. They haven't left their province in almost 4 months, but they've come to see family, spend money, and rediscover Nova Scotia. And that's what we want our own citizens to do as well. So get out there, say hi to a tourist, thank them for coming. Do it in the Nova Scotia way with a smile. If you're wearing your mask, give them a wave. And of course, do it from a distance. Remember the protocols. Stay safe and be kind. Have a great week.